Hi everyone, Nurse Cat Pink here, coming again to talk to you about baby stomach size. So I thought on my day off here, I would touch on something that comes up a lot of the time for lactating, breastfeeding parents who are new to this, and you have a newborn, or maybe you're preparing for your newborn and it's baby's first day of life is coming up. How big is their stomach and why does it matter? Well, their stomachs are pretty tiny. The first 24 hours of life, their stomach is roughly this big. So this is based on a few different things, like different studies or images that we have, decent quality evidence and other things, the clinical observations, to know that the baby's stomach is pretty darn small the first day. If we cram the baby with a bunch of milk, whether it's human milk, artificial milk, anything, the first 24 hours of life, their stomach is going to expand to like this size or this size before it's physiologically supposed to. So the baby's stomach is normally really small in the first 24 hours of life, and that matches perfectly with the mom's production. So the milk production, you have just a teeny bit of that sticky colostrum, that kind of golden stuff that comes out of the nipple, or even you might see some crustiness around the nipple that first, well, in late pregnancy, and then the first 24 hours after birth. It's a perfect match. There's a teeny tiny bit of milk coming out that's super rich in antibodies and protein and immunoglobulins and great stuff for the baby's immune system, and it's super rich in protein, which is exactly what the baby needs the first day. And they don't need more than that because they're not even going to be hungry to eat more than colostrum because they already have some amniotic fluid in here from being inside mom. So they just need a little bit of colostrum every few hours or so to be satisfied and to get enough. And they should have one poop and one pee in the first 24 hours, and that's how you know they're getting enough to eat. So I think I would say every new parent I've talked to who wants to breastfeed, who just had their baby, has not been informed, because most doctors and nurses don't know that the baby's stomach is tiny on the first day, and it's already half full of amniotic fluid, if not completely full. If the baby was born by cesarean, it's probably totally full of amniotic fluid. So that baby's not hungry. The baby's super tired and wants to rest. And something we do in the hospital is we try to force the baby to wake up every 3 hours to feed. Physiologically, that's not normal. It's okay for them to sleep 24 hours, and that first 24 hours, and they're not even hungry the first day. Now, take my words as always with a grain of salt, because I'm not talking to your specific medical situation. Always talk to your own doctors and nurses and lactation consultants before you make any health decisions for yourself or for your baby. Don't never just trust a random person on YouTube to guide your care. So take my words with a grain of salt. I don't know you and I don't know your situation. Speaking in general. All right, so after that first 24 hours, we think the baby's stomach gets a little bit bigger. So the baby gets some colostrum and has had that amniotic fluid in there, but by 24 hours of life, after that first day of life, they've probably spit up some amniotic fluid, or they've digested it and they're digesting the colostrum. You've had at least one poop and one pee in the first 24 hours of life, showing you that everything's working okay and that the baby's getting enough. By day 2, that stomach is bigger. By day 2, which means hours 24 to 48 after birth, that baby's hungry. The baby's hungry. The baby's waking up. So right around that 24-hour mark, and oftentimes it's around night or the wee hours of the morning, because a lot of babies come at night and then they hit that 24 hours old mark in the nighttime. Babies don't care about your clock or your schedule, or if you're tired, they're gonna wake up. So often moms, dads, parents will have kind of a high after the birth, and you're tired, but you're awake and you are so excited to see your sweet new baby and bond with the baby. They're just so sleepy that first 24 hours. And you might have had a ton of visitors in that first 24 hours after birth. So this is tricky, because usually what I've seen with breastfeeding parents in the postpartum unit at the hospital is on day 2, now mom, dad, or caregivers, parents, they're tired. They're real tired. And the baby has a stomach twice the size, 3 times the size now on day 2. It's really expanded. And the baby's waking up. The baby's had a ton of restorative sleep the first 24 hours, but that baby's hungry and waking up. This is the time where a lot of parents think something's gone wrong. and they think their baby's starving. Whenever I encounter, as a lactation consultant, whenever I've encountered parents who really, really want to just breastfeed and only give breast milk, this is the time where if they don't have support, they break down because they didn't know the physiologic normalcy of what's going on. And this is when a lot of moms, lactating parents can be in tears, especially if you've been through a super rough labor or a rough birth or both. Maybe you had a cesarean, if you have twins, so maybe baby's premature. So any extra thing you've had to go through where you're extra sleep deprived and tired, day 2 is hard. It's going to be hard and you need support. And the baby's hungry and waking up when you're getting to your point of like, oh my gosh, I'm tired of the visitors. I'm tired of the labor, I'm tired of the birth, I need to sleep. So this is tricky. The baby, we say feed the baby every 3 hours. That's what the nurses say in the hospital. On day 2, that baby with the bigger stomach is not gonna wanna feed every 3 hours. They're gonna wanna feed all the time. And that's normal, that's expected. Your baby doesn't have a clock, your baby does not have a watch, your baby doesn't give a about the time. The baby wants to be at the breast when they want to. And day 1, tiny stomach. Day 2, a lot bigger. They're hungrier. They're clearing out the colostrum. Their digestive system is working really well now. It's gotten the hang of things and it's digesting the colostrum. And day 2, here's the tricky part, number 3, is the lactating parent's amount of milk is still going to be very minimal on day 2. Now everyone's different, but for the first time breastfeeding parent in the 24 to 48 hours after birth, that's when your body's starting to gear up with bringing you a huge milk supply on day 3, but day 2, it's still in the gear up phase. And you're gonna have just a little bit amount, and I don't like to use the word just, you're gonna have a little bit of colostrum still on day 2. It's gonna be a little more than day 1. So like, let's say on day 1 after birth, you were squeezing the nipple and the breast and you couldn't get anything out. Day 2, you'll probably start to at least see something coming out, because it's increasing a little bit. But the body systems haven't happened yet for there to be a full milk supply. So the body takes about 2 full days or 48 hours to register that the placenta is gone out of the uterus, and that's what starts the hormonal cascade, that complex cascade of hormones, which then triggers a big full milk supply, and the breasts are suddenly big, hard, dripping with milk. That's day 3. So again, day 2, tricky, because this is when parents are tired. They've had a lot of visitors. They had a long labor and birth. They were bonding on day 1 with their sleepy baby. The baby's stomach is a lot bigger. So day 1 to day 2, the baby's tummy is a lot bigger. And number 3, the mom often will think, I don't have enough milk, because still it's just that colostrum that's coming out. So technically it's kind of true that the baby isn't getting enough on day 2, but I say that with a huge grain of salt, because as long as the baby is pooping and peeing and has at least 2 poops in the second 24-hour period of life and at least 2 pees in that second 24-hour period of life, so think of at least 2 wet, dirty diapers, they're okay. Things are working. I would not expect a 2-day-old infant or a 30-hour-old infant to be pooping and peeing like crazy. That's just not what they do. They still have that kind of sticky poop. It's not going to be a lot. If you happen to be in a hospital where all of the nurses don't have a lot of breastfeeding education on board, they might be pressuring you to be like, your baby's not getting enough. You've only had 1 poop and 1 pee, and the baby's 40 hours old. This is the 2nd day. They should have had more poops and pees. You can advocate for yourself or your partner and say, hey, we know what the baby needs. We got our education, we talked to lactation, or we know what we're doing. We're gonna keep feeding this baby, it's gonna be okay. There are also a lot of supportive staff out there, but keep in mind that a lot of doctors and nurses, even the ones who are gynecologists, obstetricians, even some midwives, aren't fully knowledgeable about what's going on with babies. Midwives, you guys know, midwives know. I'm biased towards midwives, of course, but like nurse midwives, they know all the lactation stuff. I haven't met one that didn't, but I'm sure they're out there. But more so like physicians and nurses, because that is not taught in medical school. It is not taught in nursing school, and it's typically not taught afterwards. The physiology of the infant mother breastfeeding dyad in the first few days after birth. Okay, so day 3, let's say you've made it past Day 1 and day 2, you're gonna be real tired at this point because the baby wanted to feed all the time on day 2. What I was saying is like the baby is getting enough as long as you don't restrict the feeds. Don't make the baby wait 3 hours before feeding. Let the baby feed as much as they want on day 2. And if you're tired, get support, get help. Have somebody calm and soothe the baby without a pacifier, like doing skin to skin or something in between feeds, so you can take some little cat naps if you're the breastfeeding parent. You know, and know that this is not forever, it's very temporary. So if you can get past that day 2 hump, amazing. You're dedicated, maybe a little bit stubborn. It takes a stubborn person to get past that 2-day hump. Congratulations, you're on day 3. This is when the milk really comes in, and it's perfect timing for your baby's body because day 3, their stomach is a lot bigger. So remember, day 1, teeny tiny. Day 2, a lot bigger. Day 3, the baby's stomach is expanded even more from getting more milk on day 2. So now they're hungry, they want to feed a lot. And that's perfect because day 3, so like hours 48 to 72 after birth, that's when most moms' milk comes in with a vengeance. Like you're like, okay, my milk is in, the milk has dropped, it's here. Because out of nowhere, your breasts are hard, like a rock, almost rock hard. They're full, they're really uncomfortable if you're not actively feeding. They get really full in between feeds. And now the milk is liquidy. It's no longer a tiny amount of sticky, yellowy stuff. It's now liquid, it's white, and it's dripping out, yellowish white. And you're hearing the baby gulping now on day 3. That is the normal progress of the baby's stomach size and perfectly correlating with the amount of milk. And it sometimes drives me nuts how this is not taught in schools. When I used to teach nursing school last year, for a couple of years I taught nursing school as a full-time professor, and this is something I would like always talk about, and people are like, oh, here she goes on the lactation stuff again. But if only every nurse was taught it, then we would have so much more success with breastfeeding, because it's just due to a lack of really basic, simple information, like how the stomach is tiny at first and then it gets bigger. The baby doesn't need to eat every 3 hours gulping meals the first day. They just don't. Medically, they don't. And again, take it with a grain of salt. You might have a baby who has unique needs, and if your doctor is telling you like the baby does need to eat more often, trust them. Just go by what they say. Definitely ask for information like as to why, advocate to know why, but please don't take my word on YouTube over what they're telling you. They're working with you individually. You need to listen to them, please, pretty please. And then day 2, day 3. So it's a perfect lineup with the physiology and how the milk comes in on day 3. And then this is not true for everyone. There's no like exact thing that happens for everyone's body at the exact same time. Something I can think of off the top of my head is, for some reason, it seems anecdotally like women who've had a cesarean birth, their milk seems to come in just a little bit later than women who have had a vaginal birth. And again, that's just my observation. I don't know if that's research based or has any evidence behind it, but it seems to be a thing. And it's not something that's significantly thwarted breastfeeding for people that wanted to just breastfeed. It's just sometimes there's a little extra work that has to be done and extra support that has to be gotten from lactation consultants or breastfeeding friendly nurses in the hospital, and from partners, family members, that type of thing. So that's my little blurb about infant stomach size. I think if everybody who wants to breastfeed knew about that, I honestly think that everybody who wants to breastfeed would and could for a lot longer than people currently are, just because there's so much lack of information out there. And it's stuff that your doctors don't tell you because they don't have time, and a lot of them they don't have that piece of medical knowledge. They know a ton of other stuff that I sure as heck don't know, and like amazing, smart providers, but this lactation piece is something that often you have to self-educate on. All right, so Nurse Cat Pink signing out. Thanks for listening, and definitely hit the like button if you enjoyed this, and leave me a comment if there's anything else you'd like me to cover that I can speak to, explaining something that your doctors don't have time to talk to you about. Let me know. All right, take care.